Okay, today we're going to be talking about communication. So why is that? Why do we talk about communication on a pain management program? Well, because as we know, pain is mostly invisible. So it is difficult for the people around us to know anything about what the pain feels like, or whether we are in pain. It's invisible. Why else do we talk about communication? Because when we feel misunderstood, that can feel very threatening for our nervous system. So it only serves to kind of increase our sense of threat if the people around us don't understand. And why else? Well, because we want to advocate for ourselves. So we've talked a bit about, with pacing, for example, learning to say no or asking for help. Communication, learning to communicate well, is how we advocate for ourselves and our needs. And because good communication is absolutely key for relationships, whether that's friends, family, or employers, employees, it will improve relationships if we are able to communicate well. It avoids misunderstandings. We really want other people to understand our ongoing pain. It is really common for people with chronic pain to find that their family and their family life and their friendships struggle as a result of the pain, and that's often because of difficulties in terms of them understanding and knowing how to help. It's really common for people to have had difficult times with communication, and so we often find patients will say things like, "I've just given up trying to explain it to people," but we know that when we do that, we don't get our needs met. So you might be feeling that you have to cope on your own, because people are bored of it, they don't want to hear about it anymore, or because you don't want to be a burden on people. So we tend to find that the kind of friends and family can fall into one of two camps. There's the kind of sort of, you're feeling like they're fed up with hearing about it, or they're kind of ignoring the pain now. Or on the other hand, we sometimes find family members can be overprotective, and actually when you're trying to work on things like movement, or you've set yourself goals, sometimes family can be a barrier to that because they want to keep you safe, and so they're not comfortable with you trying something new in case it sparks pain. And we often find people are having difficulties with understanding and not feeling believed about their pain as well. So that's why we talk about communication on this pain management program. So what happens when we don't communicate? Well, not communicating is actually a form of communication. And often it can result in jumping to conclusions, guessing, trying to work things out, trying to mind read, and also sometimes it can result in personalizing. So a lot of the thinking styles or thinking biases that we've introduced, I think it was 2 sessions ago, those can come up for the people around you as well. So they'll end up jumping to conclusions, or they might start taking the way you're behaving personally, and they think they've done something wrong. So those thinking biases will start to crop up, and that will in turn cause kind of other problems, other tension. And often when we don't communicate, we don't get our needs met. So when we're talking about communication, who are we talking about communicating with? Well, we'll try and cover quite a few different things today. Who are the key people we need to communicate with? Well, there's obviously family members, there's friends, there's potentially employers, and there's healthcare professionals. Now, healthcare professionals is something we will come back to again in session 8 of the program. So kind of pause that one, but we'll start to think about friends, family, and employers today. So it might be helpful for you to have a kind of list of the things that people need to know about, and we'll think about this later in this session as well. But it's something to bear in mind that it's possible that that list will be different for different people. And it might be that you need more than one list, because actually what you tell your employer is likely to be quite different to what you might tell a close friend. What you might tell an acquaintance, it might be different to what you tell a family member. So you need to think about kind of how a list differs. So let's think about how do we communicate? Um, So it might be quite helpful for you to grab your manual. So if you've not got that in front of you, pause the video and go and get it and turn it to page 31. So that's page 31 of your manual, where it should be entitled Communication and Pain. So what I want you to think about is, how do others know that you are in pain? So that question is kind of halfway down that page 31. So again, pause this video, get a pen and paper and have a think and write down some ideas about how other people know that you're in pain. Okay, and then I want you to have a think about whether those strategies are helpful. So again, pause the video and have a think and answer that question. Are these strategies helpful? Okay, well done. So thinking, do you tell other people when you're in pain? And if not, why not? Why do we tend to keep it to ourselves? Or we tend to use non-verbal forms of communication? So the difficulty with non-verbal communication, as you might have already thought about, is that it can be very easy to misunderstand. It's not always that clear to other people what your non-verbal communication meant. So we're talking about things like facial expressions, saying ouch, moving differently, doing less, withdrawing, irritability. I mean, irritability is a really good example of, it might, in your head, it might be clear that, but you're irritable, you're obviously in pain, but actually to someone else, they may personalize and they may see your irritability as something that they've done, and they may question, what have I done? What's happened? How have I offended them? So we sometimes call nonverbal communication, or in the literature, it's sometimes called pain behaviors. And what we mean by that is just behaviors that we have or we use to express that we're in pain. So here's some examples. So a lot of this will be kind of natural, will happen without you even necessarily thinking about it. But we're thinking about things like protective behavior. So you might be limping, you might be moving differently, avoiding certain movements, or you're guarding a particular body part. It might be kind of expressions like ouch, groaning, moaning, facial expressions like grimacing, wincing, changes in your activity. So you're going slower, or you've stopped something, or you've cancelled plans, withdrawing, irritability, asking for help, and then other kind of non-verbal behaviors like rubbing a particular area or shifting position. And as I've said, these are all, they're completely natural, that these are ways that you're expressing your pain. But the difficulty is that, particularly with people that don't know you as well, it might be that they just don't realize that that's what that's because you're in pain. So you think potentially that you're being quite clear about the fact that you're in pain because you've grimaced. Well, obviously I'm in pain, but actually they don't necessarily know that. So pain behaviors aren't bad in and of themselves, but there are some difficulties or some sort of some problems with them. The main problem being that people can misinterpret them. They can potentially see it as rejection. So if you're cancelling plans with someone, but you haven't said that it's because of the pain, they may see that as rejection. They may misinterpret it as just as kind of moodiness, or a lack of interest in what's happening, what they're doing. It's possible that they'll interpret it as something very medically dangerous and, encourage you to go to the A&E or something, if they don't realize what's happening. Or I think this can happen more than we realize. They may just not have even noticed. People are often quite, they're quite absorbed in their own lives. They may not have even noticed those behaviors. So you think that you've made it clear that you're in a lot of pain today, but actually they may not have realized. So these behaviors, then as I said, they're not bad. They're not you don't have to cut them out necessarily, but you just need to consider whether, if that is your only form of communicating about your pain, whether it is enough. So that the goal here is for you to understand your pain behaviors and also to help others to know what they mean as well. So thinking about that third question on your manual on page 31, is there anything else you could do that would be more helpful? So again, pause the video and have a think about that for a second. So one of the key strategies that I would really encourage you to think about with these pain behaviors is pre-communication. And what I mean by that is if you're going to use pain behaviors as a way of showing someone that you're having a particularly bad day, you need to say that in advance. So it might look, for example, like, if I cancel on you, it is not because I don't want to see you, it is because I'm having a bad pain day. If you notice that I'm moving stiffly, then it means that I'm having a bad pain day. Having that kind of pre-communication lets someone know so that you don't have to explain in the moment what's happening, but that they know in advance what that pain behavior actually means. Okay. So what are the key things that people need to know about your pain? So it's very helpful for people to understand that chronic pain is not the same as acute pain, that you have a long-term condition which involves your nervous system, and that the reason that it isn't going anywhere or that it's been around for a long time is that because it is chronic and it's a nervous system problem. Another key thing that's important for people to understand is that it fluctuates day to day. So you being able to do something on one day does not mean that you'll necessarily be able to do it on another. So explaining to people that it can fluctuate and it can be unpredictable. So you'll have some good days and you'll have some bad days, which might mean that plans have to change last minute. Again, if you're explaining this in advance, then people will much more likely to be understanding in the moment if you have to cancel. The third key thing that people need to know is that pain is often invisible. So I think patients often find it very frustrating when someone says, but you look well. So explaining to someone, well, pain is invisible and actually I can look totally fine. My hair can be done, I can have done my makeup, but actually I'm still hurting. So understanding that pain is not something that is visible, both either by a doctor or by people. The next thing for people to understand is that it affects the whole person. So it's not just pain, it affects your energy levels. You're really struggling with fatigue. It might affect your mood or your concentration and your memory. It might affect your sleep. So explaining to people the different symptoms that you particularly struggle with can really help them to get a better understanding of what's going on for you. You might want to explain to someone that it's, often you're trying to hide the fact that you're in pain. So if you do mention that you're in pain, then it's usually a really, really bad day. So explaining that you often find it difficult to express that you're in pain. Perhaps you might want to say, I find it difficult because I think people aren't going to understand, or I find it difficult because in the past I've had people not believe me or minimize it. So explaining that kind of past experience and why you find communication difficult. Another key thing that people need to know is how they can help you. So this might be just giving them permission to not fix. So it's a human kind of natural response that people want to fix a problem. So it's saying, if I tell you that I'm in pain, I'm not looking for you to fix it or for a solution. I just want you to kind of hear me and to listen and to, maybe to validate it. Something like that sounds like really tough. So that kind of providing support doesn't need to be fixing the problem. And you can say something like, do you find it a bit kind of annoying when people kind of give lots of different ideas that they've got, actually I'm not looking for that at this point. I'm just looking for that support. Another key thing people need to know is that pacing is completely essential to managing your pain. That you might need to rest sometimes if you're going for a walk, or that you might need to stop something early, you might need to leave early in order to manage your pain. So, that might be, again, a pre-communication. You might say to someone, I'd love to come to your party, but I will unfortunately have to leave after an hour or so because otherwise I'll be completely floored the next day and I won't be able to get out of bed. I have to pace myself to manage my pain and fatigue. So something like that, just to kind of make it clear why you're leaving early. And then final thing, I suppose of what I haven't mentioned previously is that the other thing about pain behaviors is that they can be, if we're totally honest, they can be kind of irritating to people. So explaining to somebody, actually, those pain behaviors, they're not on purpose. They're not me trying to be dramatic. They're just me trying to protect myself. So if I'm slowing down or grimacing or withdrawing, that's my protective response to kind of a lot of pain. So again, making that clear with people. So those are the kinds of things that you might want to write on your list of what you want to kind of explain to people about your pain. So what gets in the way of good communication? Emotions. So often it's easier actually to, if there's been a heated moment, it's often better to take a moment away, take a step back and come back to the conversation when you're both calm, kind of a bit calmer. Being aggressive or threatening. Again, people will become quite defensive if we're aggressive. So much better to be calmer, less threatening. Yeah, it's really important with communication that we have to think about it as a two-way process. So you may have your kind of agenda and what you want to explain to somebody and talk to someone about, but they also will have their agenda and what they want to talk about. So we're thinking, when we're talking about communication, we're thinking about it both ways. So being a listener as well as communicating what you want to get across. What else gets in the way of good communication? Judging, blaming, finger pointing. Again, that kind of evokes a defensive response, not an open one. Shaming or ridiculing, similarly. Silent treatment, but we've all done it, haven't we? To kind of almost giving up on communication, not saying what you really mean. So it's so important to be honest if we're trying to communicate well. There's the practical side of good communication. So, you're trying to have a serious conversation about something, maybe put the phones down, do it when it's quieter, kids aren't running around, think about what might be distracting or might kind of interrupt a good conversation. Okay, so other kind of ideas for good communication. So as I said, remember it is a two-way process. So there's expressing ourselves and there's listening. Being aware of communication barriers, whether that's the kind of practical distractions or whether that's things like neurodivergence, trying to think about what are the barriers that kind of are going to get in the way of the communication here. And then pre-communication. So absolutely key. If you want to have easy go-to ways for explaining that you're having a bad day, for example, that is going to require a conversation about that form of communication. So talking about talking. When I do this, it means that I'm having a bad day. If I cancel on you, it's not because I don't like you, it's because I'm having a bad pain day. So think about that pre-communication to make your life a bit easier. As I said, pick a good time to talk, reduce distractions. And then also really important, this is an important one for healthcare professional meetings as well as friends and family and employers as well. Being clear about what you want from a conversation. Are you looking for just some emotional support, or are you looking for specific advice about how to solve a problem? Or are you looking for a listening ear? And you can say that to somebody. I think, if you're not looking for advice, it can be quite helpful to them if they know that they don't feel the need to kind of think about how to fix it. Other ideas for kind of communication generally or kind of in relationships is to ask for positive feedback and give positive feedback. People love to hear positive feedback. So let me know when you see me managing my pain well, for example, or when you did that thing or when you said that thing, it really helped me. Thanks so much. Thank you for being so understanding, or all of those sorts of things. People like to hear that positive feedback. And actually, that might be a really helpful way for them to know how they're helping you. There are communication tools out there that you can use. So some patients I've worked with have used a traffic light system that they've kind of pinned to their fridge. So red, amber, green. And the idea is that instead of saying, today's a bad day or today's a good day, they just moved a magnet to the right color on that fridge. So the people they lived with knew today's a bad day or today's a good day. Obviously, that's an example of something that requires pre-communication. So you need to explain to people what that traffic light system is before using it. Ditto, I had a patient who would use an emoji. They would just send poo emoji, in fact, this particular patient used, to their mum if they were having a bad day. And that just, basically that one symbol just meant, I'm in a lot of pain. I'm going to go for a lie down. Please don't bother me for a while. And yeah, again, using that pre-communication, that planning, that was a really helpful message for the patient's mum to know what was going on. Other kind of tips for good communication, using kind of simple, honest language and paying attention to what your body language and tone of voice is saying. So trying to stay calm with that as well. Um, okay. And we might have talked about this a little bit when we were discussing acceptance last week, but it's really important to remember that we cannot control the reactions that people have when we're communicating. So it's important to accept you can only control how you communicate. It's important to prepare for mixed reactions. Um, and I'm sure you've all had experience of this, whether it's with the person on the bus that didn't give up their seat for you, or whether it was um, the appointment you had with a nurse, or whether it was with a close friend or family member. Um, you will have had, I'm sure, mixed reactions. And the key thing here is to stay calm. And it might be that you need to repeat your what's important more than once, unfortunately. And I know that's frustrating. And yeah, it's unfair as well that it's on you to do that, but that will often be the case. And it can be helpful to have kind of ready-made responses when things like that happen. So I've put some ideas down here. So if someone is minimizing what you said, saying something like, I know it may not look severe from the outside, I know I look well, but it affects me every day and it really impacts what I can do. Or if someone tries to fix it, I appreciate the intention, but I'm not looking for solutions right now. And it might be that you actually need to be quite clear and set a boundary. If something, if you're having a conversation which is actually incredibly unhelpful and is upsetting you, I think it's well within your right to um, set a boundary about ending that conversation. This conversation is not going the way that I was hoping it would. Let's pause it for now. Um, I'm getting a bit upset. I think it'd be better to stop this conversation now. So something that's just quite clear, um, but it kind of puts on you. I don't feel supported at the moment. I'm going to stop this conversation. And I guess, in terms of preparing for that mixed reaction, there's going to be an element of acceptance there, remembering that um, that can happen. Mixed reactions can happen. Some people won't get it. And you've got to remember that their reaction reflects them and not the validity of your pain. So your experience is valid even if others don't get it. So it's good just to prepare mentally for responses of differing kinds. And I guess it's about prioritizing the relationships where you do feel safe and understood. Those are the ones that are going to help nourish you. You can only control how you communicate. So some other stock phrases that you might find helpful. Um, I'm doing my best to manage it, but some days are tougher than others. I'd love to join, but my body's not cooperating today. It's quite a useful one. Um, I'm going to stop here. My pain's kicking in and I don't want to push it. I'm having a pain day and I need to adjust our plans. Can we reschedule or do something easier? So hopefully some of those phrases could be useful. Again, you could pause the video and write some of those down if you'd like to. Some other ideas here. And I guess this slide is really just to highlight that, what each of you would find helpful may actually be opposites. So if I overdo it, don't tell me I told you so or suggest more medication. I prefer to figure it out by myself versus someone else who might say, please let me know when you think I'm overdoing it. So your kind of what you want communicated or what you want help with might be different. Um, so I guess thinking about kind of session today, again, you kind of fill in that end of page 31. So some ideas about what might be helpful in terms of communication. And I want you to kind of have a think about, are there particular conversations that need to happen that at the moment am I getting stuck in terms of someone's understanding of my situation, or yeah, is there a kind of something that's upsetting you and you need to think about having a conversation with someone or communication? So some of this might be about having a kind of a one-off kind of deep conversation with someone, and some of it will be about those ongoing conversations with the people around you. Next week we'll think a bit more about kind of communication with those close family and friends, but just thinking about is it in terms of your friends, your family, your employer? Are there people that it would be helpful to have a conversation with in order to help manage your pain?